The HoverSling split leg is an air-assisted lateral transfer device and lift sling in one. This single patient-use product can stay with the patient, allowing for seamless transitions between lateral transfers and vertical lifts. The HoverSling split leg was designed to reduce cost and simplify patient handling by streamlining the number of devices used to transfer, lift, turn, and position a patient. And like the HoverMat, the HoverSling split leg protects staff from injuries related to patient handling while providing a more comfortable experience for the patient. In this video, we'll explain how to safely utilize the product as a sling and as a lateral transfer mattress. The HoverSling split leg has 6 red lateral transfer handles, 3 located on each side of the HoverSling. The design of these handles ensures the caregiver always remains close to the patient for safety during inflated HoverSling use. This is called the Stay Close approach. There are 6 sling support straps, 2 located on the inner side of each leg, 2 on the outer side of each leg, and 2 at the shoulder. These straps are color-coded for patient positioning and to match strap placement on the left and right side when attaching to a lift hanger bar. There are 6 storage pockets. Each one is located next to a sling support strap for use when the HoverSling split leg is implemented as a lateral transfer mattress. There are 2 sets of snaps connecting the inner sides of the legs of the HoverSling split leg. These snaps must be connected when the device is being used for lateral transfers. The HoverSling split leg has one patient safety strap that buckles over the patient. This is not a restraint, but is meant to provide a sense of security and visual comfort for the patient and caregiver. Always ensure the safety strap buckle is secured for lateral transfers and the strap is not tight against the patient's body, especially after the HoverSling split leg is inflated. There are 2 hose entries, one on each side of the foot end of the device. The hose is inserted into the opening and secured with a non-ferrous snap and Velcro closure. The label indicates the foot end and patient side of the HoverSling split leg. The instructions for use, warnings, model number, and lot number are located on this label as well. The 34-inch HoverSling split leg has a 700-pound patient weight limit, while the 39-inch and 50-inch models have a 1,000-pound weight limit. It is a single patient-use device and should be discarded upon the patient's discharge or if heavily soiled. Do not launder the HoverSling split leg. To use the HoverSling split leg as an air transfer device, the HT Air air supply is required for inflation. It is also compatible with the classic model Air 200G and Air 400G air supplies. The HT Air has an LED control panel. 3 buttons initiate airflow and a standby button turns off airflow. The standby button is the second button from the left. When the air supply is plugged into an electrical outlet, the standby button power indicator light will be lit. Press the standby button anytime you need to stop airflow. It is important to remember that although airflow is stopped, power is still supplied to the device. To the right of the standby button are the airflow options for HoverMats and HoverJacks. Press the button labeled 28-inch and 34-inch HoverMat to supply airflow for the 34-inch HoverSling split leg or 39-inch and 50-inch HoverMat for the 39 and 50-inch models. If using the Air 200G or Air 400G, press the gray button to initiate airflow. Always use a minimum of 2 caregivers when using the HoverSling split leg for lateral transfers. If possible, place the HoverSling split leg on the bed prior to receiving the patient or use a log roll technique. Ensure the patient is centered on the HoverSling split leg and positioned with his head about 2 inches down from the top edge. Buckle the patient's safety strap and adjust to ensure it remains very loose. Ensure the sling support straps are tucked into the storage pockets and the snaps in between the leg sections are connected. The transfer surfaces should be as close together as possible with wheels locked. Ensure the bed heights allow the best ergonomic working height for the shortest caregiver. Transfers should be performed from a higher surface to a lower surface, approximately 1 to 3 inches difference. One caregiver should be positioned next to the patient before the air supply is turned on. This caregiver should inform the patient of the task and explain what the patient will hear and feel. The caregiver should be next to the patient with their body next to the HoverSling split leg and hands on the lateral transfer handles. This is called the position of safety. Inform the other caregiver it is safe to begin inflation. The caregiver will then insert the hose into one of the two hose entries by opening the flap and inserting the hose at a slight angle. Snap the hose into place and close the entry flap around it. Turn on the air supply by pressing the appropriate airspeed button for the HoverSling split leg. The caregiver should stay by the air supply until the HoverSling is fully inflated, while the other caregiver maintains the position of safety. If using HoverTech's original air supply models, Air 200G or Air 400G, press the gray button to initiate airflow. When the HoverSling split leg is fully inflated, the caregiver on the sending side should begin the transfer by pushing the HoverSling split leg at an angle towards the receiving caregiver. This reduces unnecessary reaching on the part of the receiving caregiver and ensures both caregivers maintain ergonomic positioning. To ensure the patient is centered on the receiving surface, one caregiver should remain close to the patient while the other caregiver performs a visual check at the foot end of the bed or stretcher. Move the HoverSling split leg to center the patient as needed. The caregiver at the patient's side will then assume the position of safety and ask for the air supply to be turned off. Turn off the airflow by pressing the standby button and stay by the air supply until the HoverSling split leg is completely deflated. The caregivers can then raise the side rails, remove the air supply hose, and attach the patient's safety strap. There are two options for placing the HoverSling split leg when the patient is in bed. The first option is to place the HoverSling split leg underneath the patient using a log rolling technique with the apex of the sling's horseshoe at the coccyx of the patient. For taller patients, adjust the position of the HoverSling as needed to ensure it fully supports the patient's head. Once the HoverSling split leg is underneath the patient and appropriately centered, elevate the head of the bed. For the second option, the HoverSling split leg will be placed when the patient is seated in bed. This technique may also be used to place the HoverSling split leg when the patient is seated in a chair. First, elevate the head of the bed. Release the snaps in between the two leg sections. Lean the patient forward and slide the HoverSling split leg behind the patient's back until the apex of the horseshoe reaches the coccyx of the patient. Make adjustments as needed to accommodate the patient's height to ensure their head is supported by the HoverSling split leg. Then have the patient lean back to hold the HoverSling in place. Lower the bed to return the patient to supine position. Then gatch the knees and lower the head of the bed. Pull each leg section down and underneath the patient's lower body. Raise the head and lower the foot end of the bed to bring the patient back to seated position. Cross the inside leg support straps by taking one leg support strap and passing it through the strap on the opposite side. The straps can then be attached to the hanger bar. It is important to match the strap placement on the left and right side of the HoverSling split leg using the appropriate color-coded strap loop on each side. Using the shorter strap loops at the shoulder, blue or beige, creates a more upright sitting position, while using the longer shoulder and leg strap loops, white, will increase the patient's recline angle and reduce hip flexion. Attach the inside leg support straps first. Next, attach the outside leg support straps to the hanger bar. Finally, attach the shoulder support straps to the hanger bar for the proper safety and comfort of the patient. Ensure all 6 sling support straps are attached to the lift. Lift the patient according to the lift manufacturer's instructions. Once the patient has been lowered into the chair, disconnect the support straps from the hanger bar and adjust the HoverSling split leg under the patient so that it lies flat, with no straps or buckles underneath the patient. Use the same technique to disconnect the HoverSling split leg if the patient is in bed with the head of the bed raised. Please refer to the HoverSling user manual for more information.